Hi, my name's Steph. I'm one of the yoga teachers at More Yoga and also a clinical psychologist working in a mental health service in the NHS. So I'm here today to talk about how mental health is something that we all have and how we can use yoga as a healing property in times of difficulties. So mental health is part of being human and it's just as equally important as physical health. So usually if someone injures themselves physically in some way, for example, breaking their arm, breaking their leg, they may go to the doctor, they may go to the hospital, seek attention to get it fixed. Whereas there seems to be some consensus that we shy away from talking about mental health, as if it's a negative thing, as if it's something that we fear, as if it's something that we shy away from. Whereas actually mental health is something that we all have. It's our mind, it's how we think, it's how we perceive ourselves, the world, others around us. And mental health exists on a continuum. It's not black and white, it's something that some days we have good, we're happy, we're cheery in life, we're just going along and things are breezy. And other days things are harder and more challenging. And on this continuum, it's about our ability to cope when the days are harder. So in terms of not coping sometimes because life is throwing things at us, life is becoming too stressful, that's when sometimes we veer down the other end of the continuum and life becomes a bit more difficult. So thinking around what mental health difficulties look like and who experiences them and how, actually we all experience them at different times. But maybe 1 in 4 of us will experience a mental health condition or a mental health difficulty. So that likely means yourself, someone you know, a family or friend. So thinking about mental health on a continuum, Andy Puddicombe, who is the guy who created Headspace, uses a metaphor to think about the sky, such that the blue sky is always there, but on some days the grey clouds are going to come. And when the grey clouds are there, that makes life a little bit harder to go through, but at some point those clouds are going to clear. There might be a storm, they might rain really hard, but at some point the blue sky is always there behind. So using the sky as a metaphor to think about our feelings, then actually, yes, we, as part of the human condition, we also experience negative feelings as well as positive, and perhaps it's impossible, unrealistic to chase perfectionism and be positive all of the time. So when we start to struggle, it might come from an array of different causes. It could be that we're struggling at work and that we're feeling stressed. It could be that we've had a really traumatic life experience in childhood. It could be a breakup in your relationship. It could be a whole manner of things, but perhaps we need to move the conversation away from looking at individual blame for mental health difficulties that will help us to stop stigmatising why people experience these things. So to share some facts with you, 90% of people who experience mental health difficulties feel stigmatised. 65% of people with mental health difficulties report that it affects their friendships. And 26% sometimes feel like giving up on life. Some people who experience mental health difficulties won't share with their friends for the first year, and I think that perhaps speaks to the prejudice and discrimination that's in society about the negative connotations that are attached to mental health. 2 to 3 people suggest that it's related to work stress, but furthermore, in regards to employment, over half people who experience mental health difficulties see it as a barrier to applying for particular jobs. And also there's other issues related to diversity and difference around mental health. So in thinking about how we're all individuals from our unique experiences in gender or age or race or religion or spirituality means that we all make sense of mental health in very, very different ways. So perhaps it's the meaning of the experience that is different for each individual, rather than stereotyping or putting people in boxes. So when we think of different mental health diagnoses, some familiar words might be depression or anxiety, and although diagnoses can serve to some people as an answer, perhaps a label to what they're experiencing. For others, they may feel that it's putting them in boxes, and they can become part of almost a prejudice. So everyone may know someone who is a depressed person, but actually, why don't we start thinking around not labelling that person, and rather why they're experiencing low mood, and questioning what has happened to them and how we can support them. Part of thinking around mental health is your relationship with your own experiences, your own thoughts, your own feelings, how you relate to other people and the world. So how do you notice at times when you're not feeling so good? What does that mean? What does a certain mood stop you from doing? And who do you reach out to pick you up? What sort of things can you do that make you feel better? So in terms of our thoughts, when we're feeling particularly negative, we may start having very negative thought patterns, such as ruminating about the past that we can't change, worrying about the future that hasn't happened yet, catastrophizing, like things are the worst they can be, and not seeing the bigger picture. It's just some examples. So, for example, the tool of mindfulness helps us to be in the present moment, and perhaps rather than getting caught in a conflict and a battle with our thoughts, it's more about either reframing them positively, considering the positive what-ifs for a wider perspective, or trying to let go of the negative thinking in a way that allows it to be, and also challenging thoughts in the way that thoughts aren't facts. They don't necessarily bear evidence to be true. We have 50 to 70,000 thoughts a day. So some will be positive, some will be negative. It's trying not to get too attached to those thoughts. In terms of our behaviour, if we're feeling down, maybe we might stay in bed a bit more, or not see our friends, or start to eat junk food. Mood and behaviour is inextricably linked. How we think affects how we behave. How we behave affects the thoughts that we have about ourselves and the world around us. So trying to proactively reach out and do things that you know that you enjoy with people that you love and enjoy their company, and do things that will nourish yourself. Perhaps following an activity or a passion, making sure that you're getting out, being in nature if you live in a chaotic city environment. In terms of our body, when we're feeling, for example, stressed or anxious or really worried about things, our heart rate becomes quicker, our blood pressure higher, tension held physically in the body, and actually looking to ways to emotionally regulate our body. So, for example, just breathing exercises, so turning to the breath to calm down the nervous system. Doing grounding techniques, so for example, looking around the room, pressing the feet into the floor, progressive muscle relaxation, so tensing and release, but all calming and relaxing strategies physiologically for the body. And in terms of our feelings, it's about our relationship with ourselves. So what are the things that we feel grateful for, feel loving about, and how can we explore that relationship to ourselves in a way that's kind and compassionate? There's also lots of different apps that you can use as check-ins. So obviously with city living, we're always on the go, and using apps is a really great way just to have that kind of pocket tool with you. But actually, if these sort of self-help strategies aren't helping, and you feel the need for some extra support, it's absolutely okay to reach out. So I'd like to share with you a little metaphor about a life jacket. So if you swim, you learnt to swim at some point, but we all needed a little float, or I don't know, our parents' arm, whatever we needed when we were learning to swim. We needed that guidance, that buoyancy to pick us up. So reaching out for help in a time of struggling, like if we're struggling in water, we need that buoyancy to give us a little lift. Whilst we have that little lift and that boost, either from, for example, a talking therapy or reaching out to other people around us, then we gradually become a bit more resilient. We learn different coping strategies, and eventually we learn to swim by ourselves. So we're picking ourselves up again, reaching out for the help of others, learning the self-help skills to swim by ourselves. Inevitably, life is going to continue to be waves. There'll be waves that will be huge and want to drown us, but there'll be times when we'll be completely chilled, just floating on the water. Whoops. And perhaps with the tools that you've learned from learning how to swim, it's about navigating those waves and the waves that life will throw at you. Thinking about yoga as a tool for maintaining positive mental health, I can also speak to myself about the reasons that I went to yoga. It's about being stronger or more flexible or having more body confidence, for example. And I'd encourage you to think about the reasons that you went to yoga. However, what lots of yogis will experience is the initial reasons that they went to yoga become accomplished in some way. Your relationship with them changes, and then you start to learn other benefits from a regular practice. So physically, I'm going to cover a few teeny tiny examples of how yoga is a benefit. There's plenty more, but yes, it increases flexibility. Yes, you become stronger. It helps with your posture and spine, so this is all through the physical practice and the asanas. It increases blood flow, so to the muscles, and lowers blood pressure. Lowers blood sugar levels, so that's great for combating conditions such as diabetes. It helps to maintain the overall nervous system and gives you a better night's sleep. So just a few reasons about physically how yoga can be beneficial. But if we move the conversation into thinking about mental health, one of the first Yoga Sutras by Patanjali, I think I said that right, is about stilling the mind. And actually through the very, very introspective practice of quietening the mind, we learn to calm this cycle of negative self-criticism or critical thinking, which is attached to emotions of anger and fear and frustration, impatience, impulsivity. And from quietening the mind, we're gradually stilling our experience and our perspectives. From a safer, stiller place, our perspectives begin to widen. That helps us to see things more clearly rather than a tunnel vision. We're able to take on the perspectives of others, but also view life in a wider, perhaps more balanced way around us. It also can help with acceptance, for example, acceptance of your body size, your body image, your relationship with your physical self, which in turn can lead to greater confidence and greater self-esteem, also leading to increasing your sense of self-worth. Yoga can also help with patience. So, for example, sitting in postures longer and resisting the urge to move in places of discomfort, trying to release and let go of that tension. And by improving concentration and focus, we can take those learned things from the yoga mat into the work around us. So, for example, into our job, and just having more concentration, more kind of mental clarity. I think that's what I'm trying to say. Also, a good practice within yoga is karma yoga. So how do we, in a very charitable way, give without expecting return? So, for example, in certain ashrams, or maybe even local London, in local London studios, we practice karma yoga. For example, people that work there may be doing so on a voluntary basis. So giving in a charitable way without expecting upon return. I think following on from karma yoga, there's a real sense of experiencing gratitude. So being grateful for the body that you have, physically, mentally, what it allows you to do. Grateful for those around you, the people in your life. And all of these things, so the mental benefits that you get from practicing yoga lead to a much happier existence. And the more positive our mood is, the more invested we'll be in self-care. So perhaps it's more of an appreciation of yourself, as well as the connection with the other yogis in the room and the teachers that serve you. So thinking about the benefits of yoga, it's more about a journey. So where you allow the journey to take you and how it impacts your mood and well-being. But just to summarise, we've been thinking about why mental health is something that we all have. It just makes us human. It exists along a continuum. It's not black and white. Some days are good, some days are bad, and sometimes we just need help. At times of needing help, we can do things ourselves, which will pick us up, but also it's okay to reach out to others around us. So thinking about that life jacket metaphor. And also, yoga is a tool for supporting positive mental and emotional well-being. So perhaps in thinking about mental health, we should move beyond thinking about people in boxes and really, really encourage conversation around mental health and share yoga as a practice together as a ways of supporting positive well-being.